video I am making specially for medical professionals. A lot of people don't understand the real pathogenesis of frozen shoulder syndrome, why actually frozen shoulder syndrome happens, what happens in later part of life. Please go through this pathogenesis of frozen shoulder syndrome. I hope you will understand. Now there are a lot of factors supposedly responsible for development of frozen shoulder, and of course I have already published a paper where frozen shoulder is linked to repetitive strain injury on spine. Basically, pathomechanics result into serious issues on spine. What are these factors which are responsible for frozen shoulder? There are a lot of theories. However, after a thorough review and research, I am giving you some important factors. It may throw some light. First is what are the initiating factors which happen in the shoulder joint? Advanced glycation end products. These are also known as AGEs. These basically develop due to some kind of insulin resistance and compensatory hyperinsulinemia. So that means it is definitely linked to insulin resistance. Probably this is the factor why frozen shoulder is often seen among diabetic persons. Second initiating factor is chronic hypoxia. Hypoxia leading to low-grade inflammation. And this may result in endotoxemia. So these are the initiating factors which may be responsible. Now let us go into more details. What is this inflammation and fibrosis? The second most important point is inflammation and fibrosis. Frozen shoulder begins with pain and stiffness, and it slowly progresses into reduced shoulder mobility, mostly the abduction and external rotation, and it is often associated with fibrotic capsular changes and subsequently inflammatory contracture. So this inflammation and fibrosis makes the joint stiffer. Lot of synovial biopsies have shown infiltration by mast cells, macrophages and lymphocytes. They have also shown elevated levels of pro-inflammatory cytokines, IL-6, TNF-alpha and MMPs. So these evidences indicate there is a strong fibroblastic and inflammatory effects are happening in the shoulder. The third factor is neurological involvement. Elevated S100 protein levels are often reported during biopsies of frozen shoulders. Elevated S100 protein levels in patients, they point to a heightened presence of neuronal tissue, potentially contributing to the intense pain experienced. So my dear medical colleagues, S100 protein levels are one of the major causes of neurological pain. So they are seen during frozen shoulder process. And there are also some anatomical findings reveal certain evidences. Synovial hyperplasia and increased vascularization are early findings. Why increased vascularization? Probably the body wants to repair. Oxidative stress, which accelerate non-enzymatic glycation reactions that form AGEs. These are found in anatomical findings. For example, low vitamin D levels are associated with impaired insulin sensitivity, a key driver of AGE formation, especially in metabolic disorders like type 2 diabetes. progressive fibrosis is most prominent in the rotator cuff interval involving coracohumeral ligament. This may be a key factor limiting both external rotation and sometimes internal rotation. Eventually, global capsular thickening and contraction leads to restriction movement in all directions. Fifth factor, variable capsular restriction. Interestingly, in some patients, scientists have observed significant improvements in passive range of motion under general anesthesia. It clearly suggests a central or neurogenic mechanisms, possibly related to pain and fear-driven movement inhibition also. All these findings highlight frozen shoulder syndrome is not just a physiotherapy disease which can be treated very easily. No, it's a multifactorial condition involving metabolic, immune, anatomical, possibly neurological elements responsible for its development. Though research has progressed, the complete pathophysiological picture still remains elusive, making it a fascinating, although frustrating subject of study. My dear friends, I have seen more than 25,000 people with frozen shoulder syndrome. Basically, frozen shoulder syndrome creates some kind of mechanical disturbance, a repetitive strain injury on spine, resulting in loss of curvatures of the spine, multi-level disc diseases, disc bulges. If untreated, they progress into disc prolapse and so on. So this is what is very important. Vitamin D deficiency may not directly cause, but it has a close relation in forming advanced glycation end products. There are a lot of peer-reviewed research evidence to support these. My medical colleagues, frozen shoulder syndrome is not a cakewalk, and till now whatever research methodology and treatment method developed by various physiotherapists and orthopedic surgeons and other doctors is not enough. And as we studied, it is not going to become normal. I have been watching people past 30 years, still they continue to have. It has a tremendous effect of season, probably related to vitamin D absorption and many lifestyle factors which I have described in many of my videos. Hope this pathogenesis of frozen shoulder syndrome clears your thought process in understanding deep-rooted medical aspects of it. All the best, my dear friends. Take care.